This is the Daily Medical News by MD Edge, where we bring you the latest 4 stories in medicine, followed by a closer look at the day's top story, straight to your earbuds, smart speaker, or your commute. If you want to learn more about any of these stories, there are links to each of them in the podcast notes. Today is Monday, September 9th, 2019. I'm the voice of MD Edge, Nick Andrews. A few quick announcements before we get to the news. First, our award-winning cardiology team has been in Paris covering the 2019 Annual Congress of the European Society of Cardiology. We will be publishing a special conversation about the biggest data and trends from ESC next week on the Daily Medical News. Secondly, here at MD Edge, we are well aware of the physician suicide issue in the United States. This is Suicide Prevention Week, and we are acknowledging the issue by publishing special editions of our sister podcast, the Post Call Podcast, which I host. Post Call is available wherever you get your podcasts. There's a link to Post Call at the bottom of the show notes if you'd like to learn more. Okay, let's get to the top stories in clinical medicine. And on Suicide Prevention Week, we begin with new suicide data. Suicide rates in the U.S. climbed from 1999 to 2016, particularly in rural areas. This is according to the results of a new cross-sectional study published in JAMA Network Open. The researchers acknowledged that increasing rates of suicide are well documented, but they also pointed out that there isn't as much data about the contextual factors associated with the county-level suicide rates. So, they sought to examine those contextual factors. The researchers developed 3-year suicide averages for counties and placed the counties into 4 categories. Those were large metro, small metro, micropolitan, and rural. The researchers report that between 1999 and 2016, there were nearly 500,000 suicides among adults between the ages of 25 and 64 years, more than 3/4 of whom were men. They report that the suicide rate per county rose from 15 per 100,000 to 21 per 100,000. Rural counties accounted for just 2% of suicides, but according to researchers, the rates in rural counties were rapidly increasing. In addition to the connections between increasing suicide rates, living in a rural area, and higher density of gun shops, the researchers cited other contextual factors. Among these factors were higher median age and higher percentages of non-Hispanic whites, numbers of residents without health insurance, and veterans. They also found links between higher suicide rates and worse numbers on indexes designed to measure social capital, social fragmentation, and deprivation, a measure encompassing lower education, employment levels, and income. And we have an update on the ongoing vape crisis. Vitamin E acetate is one possible culprit to the mysterious lung disease that has killed 3 confirmed patients at the time of this recording and sickened 450. In all, 450 potential cases have been reported and e-cigarette use confirmed in 215 of those cases. The cases have occurred in 33 states and 1 United States territory. A total of 84% of the patients reported having used THC products in e-cigarette devices. No single device or substance was common in all the cases, which has led officials to issue a blanket warning against e-cigarettes, especially those that contain THC. Dr. Dana Mini-Delman is an incident manager with the CDC 2019 Lung Crisis Injury Response. She said that she believes that chemical exposure is likely related, but more information is needed to determine which substances. She pointed out that some labs have ID'd vitamin E acetate in some samples. Besides vitamin E acetate, federal labs are looking at other cannabinoids, cutting agents, diluting agents, pesticides, opioids, and toxins. Dr. Jennifer Layden is with the Department of Public Health in Illinois. She and her colleagues authored a preliminary report which includes a preliminary case definition that was published in the New England Journal of Medicine. Dr. Layden and her colleagues reported that bilateral lung infiltrates was characterized in 98% of the 53 patients hospitalized with lung injury. Nonspecific constitutional symptoms, including fever, chills, weight loss, and fatigue, were present in all of the patients. Patients may show some symptoms days or even weeks before acute respiratory failure develops, and many had sought medical help before that. All presented with bilateral lung infiltrates, part of an evolving case definition. Many complained about nonspecific constitutional symptoms, including fever, chills, gastrointestinal symptoms, and weight loss. Of the patients who underwent bronchoscopy, many were diagnosed as having lipoid pneumonia, a rare condition characterized by lipid-laden macrophages. And there are 4 modifiable lifestyle risk factors that account for a substantial proportion of gout cases in the U.S., thus suggesting that greater public health efforts could reduce the frequency of the condition. This is according to a new paper published in Arthritis and Rheumatology by Dr. Hyun K. Choi of the Department of Medicine at Mass Gen Hospital in Boston. Those risk factors were BMI, alcohol intake, non-adherence to the dietary approaches to stop hypertension diet, also known as the DASH diet, and diuretic use. He and his colleagues analyzed data from nearly 15,000 adults who were involved in the 3rd National Health and Nutrition Examination Survey. They calculated prevalence ratios for hyperuricemia, the population attributable risks, and variances associated with the 4 risk factors. The researchers found that 21% of men and 19% of women in the study were hyperuricemic. BMI was the most important risk factor for hyperuricemia, accounting for 44% of cases overall. The prevalence of hyperuricemia was 85% higher in individuals with a BMI of 25 to 29.9 and kept going up alongside the increase of BMI. The Daily Medical News. We'll be right back after this. And welcome back to the Daily Medical News. I'm Nick Andrews. For first-line treatment of patients with fecal incontinence, pelvic floor muscle training is superior to attention control massage. This is according to new research published in Clinical Gastroenterology and Hepatology. In the study, researchers included 98 patients with a history of fecal incontinence for at least 6 months. Patients were randomly assigned to receive either PFMT with biofeedback and conservative treatment, or to receive attention control massaging training, also with conservative therapy. They report that those who combined pelvic floor muscle training, or PFMT, with feedback and conservative therapy were 5 times as likely to report improved symptoms than those who used attention control massage and conservative therapy. They also report that patients in the PFMT group had significantly greater reductions in the severity of incontinence, based on Vasey incontinence score. The researchers said in the current trial, more than 1/3 of patients had sphincter injuries confirmed at endoanal ultrasound, which they said reflects the tertiary setting of the trial. They added that their results may be highly relevant in primary setting because there is an unmet need for treatment of fecal incontinence in primary healthcare, and the interventions do not necessarily need to be conducted at specialized centers. And finally today, a deeper look at how diet affects the risk of IBD by Erik Greb, reporting from the Preston Conference in Chicago. Evidence suggests that diet may cause incident inflammatory bowel disease and induce associated symptoms. This is according to a lecture by Dr. Ashwin K. Ananthakrishnan. He said that we need to do more rigorous studies and particularly more interventions to truly understand the role that diet may play in patients with IBD. Many patients with IBD are convinced that their diet caused their disease. A relevant point for physicians to consider is that these patients are at least as likely as the general population to have intolerance or sensitivity to food components such as lactose and gluten. He cited a prospective questionnaire of 400 consecutive patients with IBD in the UK, in which 48% expressed the belief that diet could initiate IBD. Additionally, 60% of respondents reported worsening of symptoms after eating certain foods. Dr. Ananthakrishnan added that clearly there's something to this, saying that patients' belief about the relationship between food and their symptoms are not simply misconceptions. A Canadian study published in 2016 found that almost 1/3 of patients with IBD avoid many food groups. He said that there is significant heterogeneity in the foods that are avoided, and sometimes we mistake this heterogeneity for a lack of association between diet and symptoms in IBD. A larger number of patients avoid certain foods during periods of active disease, which suggests that food exacerbates their symptoms. That same study showed that patients with IBD have more restrictive diets than do community controls. Patients eat fewer fruits and vegetables and generally consume less iron-rich food and less protein-rich food than healthy controls. GI intolerance, rather than professional advice, is the most common reason that patients with IBD restrict their diets. International research has recorded increases in the consumption of sugar and fat, particularly saturated fat, and in concomitant decreases in fiber consumption during the past several decades. The incidence of IBD has increased in parallel with these dietary changes with a remarkably similar trajectory. The correlation between dietary changes and IBD incidence holds true, even more strikingly in the countries that are now experiencing westernization. These countries have undergone more rapid dietary changes, and their IBD incidence has doubled or even tripled. The transition to less traditional diets appears to promote intestinal inflammation. Although the data on sugar are mixed, data on the association between other macronutrient groups and the risk of IBD are more consistent. Dr. Ananthakrishnan and colleagues examined the data from the Nurses' Health Study. They found that the highest quintile of dietary fiber intake was associated with a 40% reduction in the risk of Crohn's disease compared with the lowest quintile. The observed reduction of risk seemed to be greatest for fiber derived from fruits. Fiber derived from cereals, whole grains, or legumes, however, did not affect the risk for Crohn's disease. Dr. Ananthakrishnan said that an influence of diet on IBD is indeed plausible. One mechanism through which diet may exercise a causal influence on the risk of IBD is by affecting the microbiome. In 2011, investigators studied 98 healthy volunteers who answered questionnaires about their diet. The researchers also used 16S rDNA sequencing to characterize the population's stool samples. A diet high in animal protein, amino acids, and saturated fats was associated with large populations of bacteroids. A diet low in fat and in animal protein but high in carbohydrates and simple sugars was associated with large populations of Prevotella. And when the investigators conducted a controlled feeding study of 10 patients, microbiome composition changed within 1 day of initiating a high-fat and low-fiber or a low-fat and high-fiber diet. You can read more about the association between diet and IBD by clicking the link in the podcast notes. And that concludes this edition of the Daily Medical News by MD Edge. A quick reminder that you can find links to these stories in the show notes. For MD Edge, I'm Nick Andrews.